He's asking, could a person with narcissistic personality disorder benefit from CBT?
From narcissistic? Is that what you said?
Mm,
Yeah, one of my
yeah.
favorite clients had narcissistic personality disorder. And he had been in analysis on and off for close to 20 years. Um, and so that was lucky for me because he wasn't starting from scratch. He came to treatment and was willing to tell me what his core belief was, which was that he was a piece of garbage. And so that really drew us much, that really made us start at a starting point that was much easier than it is with some people with narcissistic personality disorder. What I find to be the most difficult are people who who are narcissists but don't have narcissistic personality disorder, because they're not in any pain. And they're only coming to treatment because either the boss or the spouse has said you have to go to treatment, or this is the end. But when people have narcissistic personality disorder, it means that while they do have a series of core beliefs about themselves and other people that are overly positive, such as I really am superior to other people really are inferior, they always have this stream of doubt underneath it all. And they this doubt about themselves is that they really feel quite inferior to other people. And they are always on guard. They're really hyper vigilant for people who aren't treating them the way they think that they should be treated. And when someone does something like that, and I'll give you an example in a minute, their core beliefs about inferior get greatly activated, and they usually become enraged. So I was treating this client, and I'll just give you an example of how he would become enraged. There was a coffee shop on the first floor of our office building, and he went to have coffee there before he came up to my office. And the cashier took his money, gave him change, and didn't say a word to him. And he got just incredibly irate because he felt as if she were treating him badly, which activated his core belief about being inferior. And he went and told the manager that he ought to fire this person. And this kind of hurt happened to him at least several times a day, every day. And so he was motivated then to try to make some changes. Now, what was the really tricky part about working with him initially was that he was, of course, very on guard with me, that I would treat him as if he were inferior. And it was very difficult for him to come to anybody and ask for help, much less, come to, I think, a woman, and to a woman who had special expertise that he didn't have. And he would use his narcissistic strategies with me at every session for about the first, 8 or 10 sessions, until he figured out that I was not going to challenge him and that I was going to pretty much just accept whatever he said. In our first session, he was retired. He was in his 70s. In the first session, he came to my office, and we're sitting around my small round table, and he puts his very large briefcase between us. And he says, "Do you see this briefcase?" And I said, "Oh, yeah, this is a beautiful briefcase." He said, "You know who made it?" I said, "No, who made it?" He said, the name of some Italian luggage maker whom I didn't recognize because I don't kind of buy things in that circle. And I said, "Oh, well, thanks for telling me. I like to learn these things." He said, "You know how much it cost?" I said, "No, how much did it cost?" He said, "It cost $1,200. And I said, "Oh, now that is a beautiful briefcase." And then I walked over to under my desk, and I took out my little canvas bag, and I said, and look at this. This is the briefcase that I carry. So I allowed him to feel superior. The next session, he brings in a psychoanalytic book, which is like 400 pages long. He points to a word, and he says, "Do you know what this means?" And I said, No, I don't. Can you tell me?" And he I don't remember what the word was because I've never seen it since, but he told me the definition, and I said, oh, thank you for telling me. I probably should have known that. So anyway, one of the most important things with this patient was allow him to use his narcissistic strategies initially until he felt safe enough to stop using them with me. And then I was able to really capitalize on the therapeutic relationship. One of the goal that he brought up was that he wanted his house to be decorated in a beautiful way. So he had already interviewed 3 decorators, but they had decided not to take the job. I'm sure because he used his narcissistic strategies with them. So we talked a little bit about how if he really wanted to hire someone, how he would probably need to approach this person differently. And we talked about if he really thought it was a good idea for the decorator to have more expertise than he had, then what would he say to her when he even opened the door? And we did a lot of role playing so that he would know how to make her feel comfortable enough to want to take the job. And he was able to do that at the next session. When he came back, he was just amazed that she didn't try to impress him with how superior she was. And this then became a great model for the future in dealing with other people. But before she came, we talked about why it was that he thought that she would act in such a superior way. And I asked him for some examples of people who had greater expertise than he did, who did not treat him that way. And we started to talk about our own relationship and talked about how, gee, if she really wanted this work, she probably would not try to lord her expertise over him, but rather try to just show that she would be good enough to get the job. Anyway, so CBT does need to be adjusted for people with narcissistic personality disorder, but especially if you get them talking about how they really want their lives to be, especially how they might want relationships to be a little bit different. Then you get the hook and you get the motivation to have them work on this.